Hello and welcome to this training on Pastoral Narrative Disclosure. My name is James Johnson and I am the Spiritual Programming Director at Honey Lake Clinic in Greenville, Florida. Whether you are taking this training as part of the spiritual care team at Honey Lake Clinic, or if you are watching this training because you are interested in Pastoral Narrative Disclosure, and how we apply this model here at Honey Lake Clinic, let me thank you for attending and welcome you to participating in this whole process and learning how to apply it in your own scope of care. Just a little background about myself. Like I said, I am the Spiritual Programming Director here at Honey Lake Clinic, which means I oversee our team of full-time and part-time spiritual care providers, as well as ensuring that our spiritual programming at the clinic is integrated into the other clinical areas such as medical and behavioral health therapies. I also work to manage our guest speakers and ensure that the programming we provide meets the standards set forth by our certifying officials, and making sure that the content we provide is high quality, ethical, and of course empirically proven as far as research models go to improve whole life holistic care from the Christian point of view. I'm also a chaplain in the United States Army Reserves. I have been serving there for 14 years. During that time, I've had the privilege of serving as a hospital chaplain during the vast majority of that time. Currently, I'm a brigade level chaplain overseeing unit ministry teams in the medical part of the Army Reserves, and that is really important because the Army Reserves makes up 80% of the United States Army's medical resources. I've had the pleasure of serving in hospitals, clinics, and forward surgical teams all over the world, specifically across the United States, in Germany, Poland, and across the Middle East over my 14-year and counting career. During that time in the civilian world, I've had various different jobs. I have been an educator, or was an educator, for 17 years, serving in elementary, middle, and high school levels. And I was also a school administrator where I oversaw curriculum development, accreditation, and development of our instructors. During that time, I was also an associate pastor in a local congregation in the town that my family lives in. My wife, Heather, and I have been married for 19 years. And during those 19 years, we've had the pleasure and joy of having our two daughters, Aiden and Aria. Aiden is, at the point of this recording, age 13, soon to be 14, and Aria just recently turned 12. And so as far as my education goes, I didn't mean to skip over that. I was able to receive my associate's degree from North Florida College, a Bachelor of Science from Florida State University, my Master of Divinity from Liberty University, and I am currently a doctoral student at Wesley Theological Seminary, where my emphasis and my focus of my research is on using narrative therapy to treat moral injury, and pastoral narrative disclosure is a huge part of that. So enough about me. One last slide before we move on to our material. Once again, this is my contact information. If you would like a copy of these slides to use for your own teaching and implementation, or if you'd like to review any of the notes, sometimes when we do trainings, we get so caught up in taking down the notes, we're not able to interact with the material, and we are unable to give our focus to the actual training. So if you say that you would rather have that so that you could focus your attention on the training, please feel free to call, send me a text message, or an email, and I'll be more than glad to help in any way I can. So let's get started together. This is Pastoral Narrative Disclosure. From this point on, I will rotate between Pastoral Narrative Disclosure, or PND. So if you see PND on a slide, you will know that that is what we are discussing. So what is Pastoral Narrative Disclosure? PND is a contemporary rehabilitation counseling strategy for chaplains. Also, when I say chaplains, I refer to pretty much any spiritual care provider, whether that is in a clinical setting, such as where we work in Honey Lake Clinic, in a hospital setting, in a military setting, in a corporate chaplain setting, or even in a pastoral care setting such as a church or a parish environment. And so this was created for chaplains in order to integrate spiritual care into clinical care for behavioral health care. And this was developed by doctors Hodgson and Carey, and they drew on Litz et al.'s adaptive disclosure treatment for trauma, loss, and moral injury. But what they found in this was that the treatments they provided addressed the physical issues and it addressed the mental issues, but it did not address the spiritual issues. One of the things that research has shown in recent decades is that we have failed in our treatment of our patients and our parishioners, and if in the chaplain care, whether it's the businessmen and women we work with, the political environment we may serve in, if we serve in the military, our troops, our soldiers, our sailors, our airmen and Marines, that we have failed to incorporate spiritual care into our holistic and overall model of care as far as treatment team plans go. And the reason for this is we have spent many decades, actually centuries really, looking at the person, a human being, as a two-part person, just a mind and a body. But we recognize now there is a third category that religion has been telling us this for as long as humanity has been around. But in the recent centuries, we've dismissed the spiritual care because we have assumed that religion was being used to answer the unknown, and science and technology have allowed us to discover those answers, so we should throw the spirit idea out with the bathwater, so to speak. But as a result of this, and I heard this metaphor a few weeks ago and thought it was beautiful, we have thrown the gold out with the gravel. That yes, there are certain things in the world of religion that are harmful. There are certain things in the world of religion that are complicated and can confuse or mess up some of the modalities within medical and behavioral health care. But we do recognize that spirituality gives us a connection to meaning and purpose, to something greater than ourselves. And the studies show that when a person has a strong spiritual religious worldview that makes sense of the human experience, it increases their resiliency, makes them less susceptible to traumatic distractions and destructions that can happen to their mind and their body, and it allows them to experience what we're going to talk about more in a little bit, which is post-traumatic growth. This allows the person to not just experience recovery physically and mentally from trauma, loss, and moral injury, but also learning how to process it and become stronger, to become better as a result. Now, I will put the disclaimer out here that as a Christian chaplain, as a ordained minister in a Christian denomination, and as a leader of the spiritual programming department at a Christian behavioral health clinic, I do believe that the Christian worldview is the only one that makes sense of the human condition. And so I do have a tendency to move and gravitate towards that particular area when we talk about spirituality. But please recognize that this model of pastoral narrative disclosure, as well as treatment for spirituality in general, does not have to be segmented off just to the Christian population. Any person can receive benefit from using the pastoral narrative disclosure model in their therapy. So just understand that as a disclaimer from the beginning. So that's what pastoral narrative disclosure is. But before we get into the meat of it, we need to have a little bit of background with some vocabulary. The first one we need to discuss is this idea of trauma. Trauma is an emotional response to a terrible or tragic event such as an accident, rape, or a natural disaster. But what's important to recognize is that trauma is different for every person in how they process events. For example, the loss of a relationship for an adult may be painful, but it may not be traumatic, whereas for a young child, such as a 5-6-year-old who loses a parent through divorce, or who ends up moving away from their support system when the family gets a new job and relocates to a different part of the country or even a different part of the world. What may not be traumatic for an adult who is in a more mature and more understanding, experienced part of their life may be incredibly traumatic for a child, depending on their age and their understanding of the world and the way the world works. Seeing a person die of old age may be painful, but it may not be traumatic to an adult. But for a younger person, imagine a young adolescent who has never truly processed their mortality. Being there when a loved one passes away can be incredibly traumatic. So trauma is different for every person and how they process the events. The reason we bring this up is it can become very common for people to dismiss another person's trauma or the traumatic events they are going through in their life simply because it does not bother the person. That, if I look at a situation and say, oh, that's not a big deal to me, that does not mean that it's not a big deal to someone else. I remind patients fairly regularly that trauma is trauma is trauma. If you feel like it is trauma and you experience it as trauma, then it is traumatic. So as we look at this idea of trauma, it's an emotional response to a terrible event. And the vast majority of people experience trauma. The question is, how will we cope with it? We also need to make sure that we discuss and understand what a soul wound is. Soul wounds are what we experience when we have a spiritual injury that results from a traumatic life event. And what happens when we experience trauma is until we create a process to successfully cope with this traumatic event in our life, it will create us a separation between meaning and purpose in our life. Like we talked about before, in general, spirituality is our longing for something greater and our desire to be connected to meaning and purpose in our lives. But trauma creates soul wounds that disconnect us from that. For example, go back to that young, preteen who has just truly experienced and come face to face with death in their life through the loss of a loved one. Even if that loved one died of natural causes such as old age, even if that loved one was extremely old, say they were 98 or 100 years old and they died of natural causes in their sleep, for that young adolescent to come face to face with the idea of death and their own mortality will create a soul wound, where they recognize that they only have a finite amount of time to live. When we're younger, we are very egocentric and we are very self-focused and we believe that life will go on forever. But what we see in trauma is trauma brings things back to reality, especially in the young and unexperienced mind. So this soul wound has to be dealt with. But what we've done for so long in our therapeutic practices is we have dismissed the spiritual, like we spoke about earlier. We've tried to treat it other ways. We've tried to look at it from a cognitive perspective. What's the mind doing? We've tried to look at it from the physical perspective. What's the body doing? But we haven't recognized there's a third layer, the spiritual. And that's why this is important. So why pastoral narrative disclosure? Well, as we briefly spoke about, this idea of a soul wound is important, and what can result through these wounding events, these traumas that impact our soul, is that we can create other long-term problems. So since the original definition of moral injury was coined by psychiatrist Dr. Shea, he actually started working on this in the 1990s, but it was officially accepted in the early 2000s. There's been numerous explanation and debate to account for the I love it says coagulated complexity in my notes, but it's this idea that there are many layers to trauma, especially on the spiritual side. It's a complex scenario, and everybody experiences trauma differently. And that's due to the personal impact of moral transgressions that are not considered under PTSD. You see, PTSD, as we'll talk about more in the future and later in this presentation, is dealing with our physical injury, our fear of death. But moral injury happens when we feel a betrayal or a transgression or a compromise against our moral, our ethical beliefs about the way the world is supposed to work. The violation of these deeply held moral beliefs and ethical standards, irrespective of the actual content of the trauma, can lead to considerable moral dissonance, which, if left unresolved, leads to the development of core and secondary symptoms that can occur concurrently. What does that mean? That means that regardless of how life-threatening the situation may be, when a person experiences a morally injurious event, those spiritual woundings, those soul wounds that we talked about earlier, can become so powerful they can actually create other symptoms that are associated with other cognitive dysfunctions such as PTSD. So let's give a quick scenario just to start wrapping our mind around this. When I was working with a soldier in the Middle East, they had just returned from Iraq, and they had been in numerous combat situations. This particular soldier was on their third combat tour in the Middle East. And he told me, he said, "Chap, there's no telling how many firefights I've been in and how many people I've shot and probably killed." But he told me he never wrestled with those situations because he was in a kill or be killed situation. He was trying to protect his fellow soldiers, and the people shooting at him were adults. They were enemy combatants, and he did what he had to do. But he told me of a situation he had recently experienced where he was driving through a small village. And if you're unfamiliar with some of the past tactics that during the war on terror, that some of the Middle Eastern insurgents were doing against the military forces on the United States and other coalition forces, what they would do is they would bury bombs and explosive devices, what we call IEDs, under the dirt of the road that you couldn't see as you were driving by. Then they would try to cause a distraction of some kind to get a vehicle or a convoy of vehicles to stop. That way they could detonate it from a remote location and injure the convoy and hopefully injure personnel in the process. So one of the things that convoy leaders are taught is to never stop, no matter what. If you can help it, you do not stop. And so as he was leading this convoy of vehicles through a small village in Iraq, a little boy kicks a soccer ball into the road. And he has to make a split-second decision. Do I mash on the brakes, stop the convoy, let the little boy get his ball and continue on? And if he does that, he may make room for an IED to be exploded underneath his vehicle or another one of the vehicles in the convoy. Or he can continue going and run the little boy over. He has a split second to make a decision, so he mashes on the gas and runs that little boy over. While he did not experience physical danger because the bomb never actually went off, and possibly he could have experienced PTSD from that, the real trauma that he experienced was in the decision he made to kill that little boy. That is a soul wound. It conflicts with his belief that children are innocent and that they should not be hurt. You see, this created tons of other symptoms besides just the feeling of regret. Some of these symptoms that are usually commonly identifiable are shame, guilt, a loss of trust, and spiritual existential conflict, including the ontological loss of meaning. Ontology is the study of meaning, what gives purpose to something. So when a person has no ontological purpose in their life, no meaning, then they can have an incredibly healthy body and an incredibly healthy mind and still experience despair in their life because they have no reason to live. So this man was experiencing all of these things because of his situation. And we can experience these things, like I said, without being physically put in danger. Now, yes, he had a physical fear of a bomb going off, but we can experience these problems in other situations. For example, let's think of the same situation with a child. Let's say that the child develops a cancer such as leukemia, and a parent has to watch their child slowly go through the pain of cancer, to lose their health, to wither away, to lose that healthy life that they once had, and to eventually die at a young age. In my hospital work, I have seen this happen numerous times to young children and parents who are never in any physical danger of their own. Obviously, this is still traumatic, and more than that, this is a soul wound. that they believe that there's a way the world is supposed to work. In our American culture, we tend to believe that children should outlive their parents, that parents should not outlive their children. Thanks to the miracles of modern medicine, the norm is for children to live far longer than parents because of how healthy we're able to keep children in this current postmodern age. So when people experience these symptoms of shame and guilt, loss of meaning, this is not something that can be fixed by fixing the body or the mind in itself. We need to fix the spirit. There are other core symptomatic features that can influence that the pastoral narrative disclosure model can treat, such as depression, anxiety, and anger. They can re-experience that moral conflict by having flashbacks. They can work through their, having these nightmares. They can have, things that trigger these reliving of the moment. They may have social problems such as hypervigilance. They may have withdrawal and isolation. This of course can lead to relationship issues and ultimately even to self-harm. So when we look at these situations, we have to recognize that these are things that cannot, as we've mentioned before, be treated by treating the body and the mind alone. There's a third leg to the stool that allows us to form a treatment plan that treats the whole person. And let me say this from the outset, this was not meant to be a cure-all. This is one layer of many layers that a treatment team can provide to a patient. But this is the value of incorporating the spiritual into the treatment plan. That when a treatment team treats the mind, the body, and the spirit, they can treat the whole person. Thinking about post-traumatic growth again, this idea comes from this concept that a person can go through a traumatic event, a very trying and struggling life event. They can actually go through that and become stronger at the end. The idea of resiliency allows us to reconcile that when we are a resilient person, we can either be a tennis ball, which is resilient, or we can be an egg, which is not. If a person has created a strong religious spiritual worldview that makes sense of life and their experiences, then they can experience post-traumatic growth and become stronger, like that tennis ball that's thrown against the wall and bounces right back. But an egg is not resilient. If a person does not have a strong spiritual religious worldview and they encounter trauma, they're going to be like the egg. An egg does not bounce. An egg hits the floor and splatters. And like the old nursery rhyme says, all the king's horses and all the king's men can't put it back together again, right? And so how do we experience post-traumatic growth? With proper help, a person can utilize their morally injurious experience, these traumatic experiences, to become better as a person, learn how to cope, and can actually enjoy life once again. And that is the goal. I compare this often to a bone when it's been broken. When a bone is broken, if it's set properly and a professional puts it in the right place and uses professional methods such as casts or even screws and bars, that one day the cast can come off, the screws and the bar may be able to come out, and that bone will have healed stronger than it was before. The body has this ability to heal stronger if the bone is set properly. The body can make it stronger than it was before the break. And this is true of our spiritual life as well, that when we go through these traumatic events, we can process it appropriately and we can actually become more resilient and stronger and experience post-traumatic growth. So we're going to use this case study as we go through our training today, as we continue on to learning how to apply the pastoral narrative disclosure model. So let's read this case study together. Joni is a 21-year-old female who has come to the clinic after moving away to college, where she became addicted to cocaine. She says that she initially started using it because her friends were, but she kept using it because it filled the hole in her heart and made her feel alive. She wants to get off drugs but does not want to feel empty anymore. Now, this is a actual true study. This is a patient that I worked with, and we, of course, for HIPAA and all of that, we changed a lot of the details about the person, but the core scenario is still the same. This is a person that got addicted to a substance originally because they wanted to fit in. but they continued doing it because they recognized that the substance that they were taking filled a part of their life that was missing. They had this connection once again to happiness and fulfillment and connection to community. And by leaving that addiction behind, this patient is going to lose those things. And they say that they don't want to lose that fulfillment that they experienced in life when they give up their addiction to the substance. So how do we find a way for this person to find fulfillment and connection, to fill that void in their heart, in their soul, in their life? Well, we use the pastoral narrative disclosure. So we're going to talk about Joni along the way as we work through these steps. Pastoral narrative disclosure has 8 stages. Now, one of the reasons why this is very favored by clinicians in a setting like this is because most of the time spiritual care providers will not get a whole lot of sessions with a patient. When I've done hospital work, there are times where I may meet with a patient 1 to 2 times. And in that case, going through all 8 stages of pastoral narrative disclosure, it's impossible. And there are times where the spiritual care provider may not be able to go through all 8 stages. What they can do is lay the groundwork for the patient to continue working through this along the way. Many times when a spiritual care provider uses this model, they don't have to make it incredibly formal and say, we're going to use the pastoral narrative disclosure model in order to treat your spiritual problem. But we can work through the 8 stages. Depending on how long your appointments may be, you may be able to combine 2, sometimes 3 steps. More than that is very difficult. But I have found in certain situations with a very motivated patient, a person that I'm working with, we can move through some of these faster than normal. But the recognition is we do want to have the patient go through all of them if possible, and we don't want to shortchange them if possible. But there is a reality in the clinical setting that the patient may not attend enough sessions with their spiritual care provider. And that could be all kinds of reasons. Maybe they get transferred from one hospital to another. Maybe they don't show up for appointments. Maybe if you're a pastor, you begin the process and because of the severity of the trauma, you have to make a handoff or a referral to a licensed professional, such as a therapist or a psychiatrist, right? Those kinds of things can happen. But as much as possible, we want to try to keep the integrity of all 8 of these stages, and they work in concert together. So let's start at the beginning. The very first stage of pastoral narrative disclosure is building rapport. When you build rapport, you create an atmosphere of trust between the patient and the chaplain, or it could be a pastor or spiritual care provider. If you're not comfortable with the word chaplain, that's okay. That's just a common term in the clinical environment. And the goal is that the chaplain ensures absolute confidentiality. Now, depending on your setting and your environment, confidentiality does change. And you as the spiritual care provider need to be upfront and forthright with the patient you're treating as to what level of confidentiality you're able to provide. You need to give them that on the very front end during these initial meetings when you discuss, what these meetings are going to be for and get to know each other. In a hospital setting, you may have to spend some time building that trust and getting to know each other. In a pastoral care setting, such as a church, a mosque, a synagogue, or even in a situation where the person may already know the pastor, the imam, or the rabbi, these parish settings are a lot easier to build rapport because they probably already know each other. However, building enough trust to trust that person with your traumatic event shouldn't be taken for granted. Because just because a person knows their rabbi for 10 years doesn't mean that they feel comfortable talking about a traumatic event such as a sexual abuse situation, especially if, and as we've seen in recent years is becoming more and more common, some of these traumas may actually have taken place within the setting of the religious setting, such as the synagogue or the church. And so this rapport is very important. And like I said, you need to make sure you tell the person that you're working with what level of confidentiality you're going to be able to keep with them. One of the things that we recognize as a legal precedent is the pastoral care what we call the confidentiality between the pastor and their parishioner, right? This level of sacredness that happens, especially in situations like in the Catholic tradition, the Catholic faith, that the Catholic Church has trained their priests that they understand that what is told in the bonds of confession, right, is something that is kept. It's between the priest, right, and their parishioner. However, there are certain things that are mandated reporting. And so depending on your environment, you may be in a situation where you have to break that confidentiality in order to protect other people. For example, in a clinical setting, I tell patients that I can give them the confidentiality up to the point that the clinic I work at's rules and policies allow. And I've worked in some hospitals where certain things were mandatory for reporting, such as self-harm or their desire to hurt or harm somebody else. And so I have to let them know in the beginning, if they tell me that they have an intention to take their own life or the life of someone else, that I have to report that. However, if they tell me about crimes that they've committed or drug use they've had in the past, things like that, that can stay confidential. Another specific example is within the military, that in the military chaplains have 100% confidentiality. That means even if in my military setting, if one of my troops tells me they plan to take their life, then I have the legal and ethical responsibility to follow what the Uniform Code of Military Justice says. So we have to make sure that we're forthright with the patient. That's why I say caveats permitting, that we keep that confidentiality. But in the overwhelmingly vast, I would say 95+% of the time, you're able to have that confidentiality between the spiritual care provider and the patient. One of the things that I highly recommend, it's a great best practice when establishing rapport, is to use an initial assessment tool. There are many different initial assessment tools out there. The one that I favor was created by Queen's University, and it's called the FICA assessment tool. And I love to use this one because it's easy to remember. It's just 4 steps, but it also is a wonderful lead into the 8 phases of pastoral narrative disclosure. So we begin with asking the patient what their faith or beliefs are. I love to ask a person, do they have any spiritual practices? That's a very low level, low key, low risk question, because pretty much everybody, I think I've only met 1 or 2 people in my entire life that would not admit to having some type of spiritual practice, even if they were not a person of a particular religious faith. A person may say, yes, I have a spiritual practice of walking around the lake and watching the sunrise, and that's where I find peace and contentment. They may say that they have a spiritual practice of exercising that helps them feel renewed and refreshed, or going once a year to their family's cabin in the mountain for a few weeks, right? These are spiritual practices that are not necessarily connected to a religion, but they can be. A person may have a faith in Islam. They may have a faith in Judaism. They may have a faith in Baha'ism, or Sikhism. They may have all these different kinds of faiths and beliefs that give their life connection, meaning, and purpose. And that's where the I comes from, where we ask, hey, how is this important to you? What gives it so much power in your life? One of the things that I have met as people have certain rituals in the morning. There is a lady that I've been meeting with in recent months that she is very heavily into yoga, and she finds that the days that she does her yoga practices, that she's able to approach her workday with a sense of calm and has more patience with her coworkers. She has a better sense of self and appreciation and gratitude for her life. When she skips her morning yoga routine, her morning yoga rituals, then she does not experience those increased positive things. Instead, she actually finds the negative, the opposite to be true. She's less patient. She's more critical. She's more negative in her perspective. So recognizing what is the importance or influence of your faith or beliefs in your life. And then the C stands for community. Do you have a community you do this with, or is this personal? One-on-one. And in this age of technology, the community may be online, One of the things that is very often overlooked because it's seen in a negative way is the online community of video games or esports. That people may know people almost intimately that they do not know in person. And there are a lot of more recent studies showing that people find connection and community even with people they've never met in person before. That there's a powerful source of connection that way. And so helping the patient understand where is your community or your lack thereof. They may say, wow, I don't have a community. Or they may say, I used to have a community, but ever since that traumatic event, I've lost it. And that moves us into the A to say, okay, what issue are we going to address because of that? So going back to Joni, let's say that Joni in her situation grew up in the Christian church and that she largely adheres to the Christian faith. And that it was important to her because it influences her view of right and wrong. And that once upon a time she had a community there, but one of the things that she's been wrestling with is how closed-minded and closed off she feels the Christian church is towards people in this current generation. As a college student, she may look around and say, wow, the Christian faith is very closed-minded and are pushing people away and calling the things that other people do wrong. And she may have inner conflict with this. And so she may have a loss of that connection that she used to have because now she's doubting whether the Christian faith she may want to keep her faith in alignment with that. This allows us to address the spiritual issue, and it helps make more sense to give more light on why she feels this need to fill a void that she no longer has of connection to community. So as we move from rapport and now we have an issue we need to address. And so we can move from the initial assessment tool, the FICA initial assessment tool, to move into how do we address the spiritual issue of this lack of connection, this lack of community, this lack of fulfillment that Joni has in her life. The second phase of the pastoral narrative disclosure model is reflection. This is when, after the rapport is built, that the spiritual care provider helps the patient to reflect on their situation. And we say, why does this even matter? Why is this a big deal? For some people, to lose something may not be a big deal, right? Maybe they had a diamond ring that they bought because they thought it was pretty. They lose it, when they go water skiing and it falls into the lake or river and they lose it. Well, if they have insurance, they go to their jeweler and they get another one. They may even get a more valuable one, right? They may end up getting something better. But now let's pretend that diamond ring was not just a trinket they bought for themselves. Maybe it was their great-grandmother's wedding ring that was passed down from great-grandmother to grandmother to mother to her. And that person lost that diamond ring water skiing, and now not only is there a loss monetarily, but the insurance will never replace the emotional connection, right? The reflection of why is this important? So as we look at Joni's situation and she reflects on it, she recognizes, wow, I really am wrestling with this spiritual issue of not being satisfied with the Christian faith tradition that I was taught growing up. She may sit there and say, wow, I no longer feel connected to this community, and that's why I feel so drawn to the friends I've made in college who are doing these things, who are using cocaine, and I want to be connected to them, and I want to do what they do because not only do I feel good from the drug, I feel connected to the community. So now that she's reflected on this, she understands why it's important. And we as the pastoral care provider now understand why we need to work on this more than maybe other things. Because the reality is sometimes a patient will come to a session with many problems and many questions, especially in the world of faith. They may have many questions about, for example, the Bible and why is the Bible trustworthy? And that may be an important issue, but it may not be as important as other issues. So our job as a trained professional in the world of spiritual care is to suss through, to filter through these problems to say, wow, what's the most important one that needs to be treated? Now, usually I prefer to do this orally, meaning to have them talk about it out loud so I can guide the questions, not to guide them to the answer I want them to have, but to help them work through the process. But not every patient feels comfortable with this. Not every amount of time that we have to meet with a patient may allow for this, because this process may take 15, 20 minutes. It may take 2 or 3 hours, and we may just not have enough time for that. And so you may find it helpful to give them a reflection sheet to say, your homework until we meet tomorrow or next, in a few days, is to reflect on why this is such a hard deal for you to work through. Why is this such a important issue for you to think through and consider? So they can reflect on their life journey and that morally injurious experience. After the reflection is done, then we as a team can begin to review the situation. This helps us to say, how did you get here? What steps and events led you to this moment? So for example, with Joni may sit back and review, wow, I grew up in the church, and I remember being in the youth group at my church community, and I felt such a connection. I was a leader, and I had friends that we believed the same things, and my parents approved of me and told me they were proud of me. And I had not only their approval, but also their acceptance. And they celebrated me, and I was, somebody that was respected and known and appreciated. But when they moved off to college and began to see how their friends who came from alternative lifestyles were being, in her mind, mistreated and condemned by the Christian church that she was around, this began to create a break in her desires and her connection to her faith. And so as she leads and says, wow, when I moved away and went to college and began to encounter other perspectives, when I began to see the bigger picture of the Christian faith than just what I had grown up with in my local church community, that she may say, wow, this is really where the divide began to happen. They considered the past thoughts, words, actions, omissions, especially about themselves and their identity. You see, our perspective is tied to our worldview. And our worldview, which has its own, there's so much we could see on it. We could spend an entire session on worldview, but our worldview is literally the way we view the world. And when we encounter trauma impacts our worldview. And it may cause us to either reaffirm and say, my worldview makes sense, or it may shake us and say, wow, my worldview is missing something. It may even be fractured or broken and need to be replaced. So reviewing the situation helps the patient and the spiritual care provider understand what events and steps led to the current situation. After this, we can work on reconstruction. Reconstruction is when the patient is able to look at their moral, ethical issue related to the event, but also their feelings. How do they feel about this? And so one of the things we may be able to say to Joni is, Joni, wow, you used to get your feeling of connection from your church community, but now you're finding that you're not sure if you agree with your faith community anymore. And so we may ask them, are you disagreeing with the faith in general or that particular faith community? And this can be true of any faith community, regardless of religion or spiritual group that they may come together, that the group may not represent the beliefs of the overall whole of the faith. So one particular synagogue and that rabbi's teaching may not represent all of the teachings of Judaism as a whole, right? One particular imam's teaching may not represent, in that mosque, may not represent the teachings of the Quran in general or Islam as a whole. Same thing with Christianity and many other faiths, right? That one small group may be twisting and perverting the teachings to accomplish a purpose. Or maybe they do. Maybe they do represent the whole. But in either way, we have to say to the patient, how can we reconstruct the situation to make sense of it? Where do they land in the issue of faith? In a situation where the person may feel betrayed by God. So let's switch away from Joni's situation where she's longing for community. Maybe a person experiences a physical trauma, such as a sexual abuse. And that person may come in and say, God is supposed to be all-powerful and all-loving. But if that's the case, why didn't God intervene and stop that person from sexually assaulting me and treating me that way? Why didn't God stop them? You see, now we've got an issue where they have to make sense of their worldview to say, this event does not match up with what I experience in the world. In Joni's situation, she has to say that she wants to find a community that gives her meaning and purpose in life that also aligns with her personal views on different groups that can be considered minorities in our current situation, our current state of being. For this other person, they may have to say, how do I come to terms with my faith and the fact that the God I believed in, or at least the view of the God I believed in, did not come to my rescue the way I thought they should? Does that mean I have a fractured view of God, a misunderstanding? And we as the spiritual care provider can help them sort through these broken pieces to put it back into a picture that makes sense and help them understand, are there certain things that I need to keep of my worldview? Are there certain things that I need to change? Are there certain things that I need to leave behind? And that reconstruction leads us to the fifth step. And that fifth step is restoration. Restoration happens when the person is able to go through their grief. They're able to be heard, and they're able to get a sense of understanding and actually find some acceptance. Now, this is where, depending on the severity of the issue, the timing of the situation, that this may not always be possible. Because one of the greatest ways to find closure is to have that confrontation in a peaceful way, which sounds like an opposite, but it's possible, where the person goes to the person who has hurt them and helps to make sense of the situations. For example, let's say that Joni ends up meeting with her family and saying, the way you raised me in the Christian faith was not accepting of people who are different from you, and I feel like the church is condemning. Well, this may be a chance for Joni's parents to say, Joni, we didn't mean to teach you that. One of the core teachings of the Christian faith is to love your neighbor, right, like you love yourself. And they would say, Joni, we're so sorry that in teaching you this, that we didn't clarify that while we have different beliefs from other people, we still love them, we still value them, we still see them as made in God's image. And Joni may be able, through that restoration, to say, wow, I was missing that piece. I misunderstood that. I did not get that clarity. And she may be able to get a sense of restoration. And maybe that the parents may have been the perpetrator. Maybe her church leadership may have been. And she may be able to sit down with her church leadership and say, when I hear you teach on what right and wrong, I hear you from the pulpit talking about how wrong these people are when you don't know them. And they may say, you know what, Joni, you're right. It's easy to condemn the practices of people we don't know and ignore the ones of ourselves. And they may say, wow, it's easy to when it talks to alternative lifestyles, right, and minority groups, it may be easy to condemn them from the pulpit in the Christian church community that Joni was a part of, but they may not address issues such as gluttony and gossip. Why? Because those are things that person or that particular church community may be struggling with. And they may be able to get some apologies, they may be able to get some restoration. But sometimes this is not possible. Perhaps the person who committed the traumatic event is dead. Maybe they're inaccessible, or maybe the therapist feels like it's not healthy for that person to have a conversation to try to create this restoration. There are many ways around that, and we're going to talk about that in the next step, but we need to recognize that it's not always perfectly possible to accomplish restoration the way we would ideally have it, for numerous reasons. And it's important for us as the spiritual care provider to be sensitive to the other members of the treatment team, to work with the therapist and the medical provider to ensure that we are not causing more problems, we're actually helping. And this is where, if possible, I would suggest being part of a treatment team meeting. Maybe the clinic or hospital you work at does not involve the spiritual care team. Invite yourself. Ask if you can join and get the insight, and eventually you'll do what we call in the Army of earning your seat at the table, where you have a voice to speak into the treatment plan for this patient, to say, hey, I've observed this, I've been working on this with them, can I share? But the most important thing it does is it gives you that ability to say, I think this is valuable, but I also don't want to harm the treatment plan you've created. And that actually ends up making you an ally instead of an enemy. Now, if you're in a scenario where you don't work in a clinical setting, such as a church setting, a parish setting, then you may need to be mindful of what the law says, right? You may need to be mindful of what would actually be better, and you may need to either make a referral or seek a consult where you reach out to a person you trust. And it's very wise for every spiritual care provider to create strategic partnerships with people to reach out and to share with For example, one of the things that I have done regularly is every month I give my time to, for free, teach a webinar to a group of Christian therapists. And I share a tool from the spiritual perspective for them to learn to incorporate into their practice. As a result, I have many strategic partners that when I need an opinion, I can reach out and get their perspective. That's a strategic partnership that we can create. So restoration may not always be perfect. All right, what do we do when it's not possible to confront or have these conversations in person? This is where the sixth part of the ritual comes in. Let's say that the person that needs to be spoken to, that maybe Joni's pastor that she grew up with, that gave her this worldview of how Christianity views people that's flawed. Maybe he's passed away. Maybe he's moved away. Maybe he or she has gone into a place where Joni lost contact and she can't find them. That happens, right? The world's a big place. Maybe that pastor, he or she became a missionary and they're living in a different part of the world where there's not a lot of communication. So Joni may not be able to speak to that pastor to have that peaceful confrontation to address the issue of saying, this is what you taught me, and I don't feel like it lines up with reality. So what can they do? Joni can do a ritual. And rituals, a lot of times when I teach on rituals, a lot of people I work with think of some of these, more, religious idea things like drawing pentagrams on the floor, lighting candles, doing seances, right, in cemeteries, those kinds of rituals. But a ritual is just something that a person does that allows them to experience emotional processing. It can be formal or informal. It can be secular or religious. But the goal is to work through the emotion, whether that's regret, naming a mistake, working on self-forgiveness, or forgiveness of other people, to experience a reconciliation of an internal conflict. So rituals are very powerful, and sometimes we do them without realizing it. Maybe we have a ritual where before we leave the house. So for example, I have a ritual when I leave the house. I go person to person in my home. I kiss them on the forehead, give them a hug, tell them I love them, and tell them how much I value them. And it's just very quick. It's not a super long one, but we kiss each other on the forehead. We give each other a big hug. I say, I love you and you're valuable. And I get in my car and I go to work. And I do that for two reasons. One, because I want my family to know I love them, but also because it relieves the stress of what happens if I don't come home today. And we don't like to think that way, but there's a chance every time we get on the road, every time we leave the house, even when we walk around our own home, that we don't live forever. And life is precious. So that ritual, as simple as it is and as normal as it is, gives my life meaning and helps me to have reconciliation. If there's conflict in my marriage, then it gives me a chance to get it right with my wife, even if we haven't addressed everything, to look each other in the eye and say, we love each other. We're committed to each other, right? And we're still going to work through this later, but for right now, I got to go to work, but we're still admitting we love each other and we're together in this. And so this ritual can create power. Now, rituals, when I said this, like I said, they don't have to be religious. This is why I recommend what's called a therapeutic ritual. It may have a religious and a spiritual connotation that's specifically religious themed, or it may not. But it's a series of actions performed in a prescribed order that integrate the mind, body, and spirit. And so to be a therapeutic ritual doesn't mean it doesn't have to be a religious ritual. In order for it to be a therapeutic ritual, it has to have three things. It has to have a behavior that occurs in a fixed succession, one after the other, formality or repetition. These behaviors have to be symbolic in meaning, and they have to have no obvious useful purpose of their own. Now, obviously, for example, a kiss, right? A kiss is obviously it's useful in making a physical connection of intimacy, but it also can be something that's symbolic. When I, kiss my children on the forehead and I put my head against theirs, it's a sense of connection to say we have the same mind. We're connected this way. We're thinking the same about each other and recognizing that each person is valuable. But it may have no other useful purpose. Another ritual that a person may have when they are working through something. For example, here at the clinic we work at, we do something called a rock leaving ceremony, where during a patient's time at Honey Lake, they paint a rock, and that rock can symbolize all kinds of things. It can symbolize their pain and their struggles and their fears. It can symbolize their hopes and their dreams. It can symbolize themselves, a family member, a season, whatever the patient feels is the most powerful thing in their life. And then at the front of our property, we have a big, beautiful gate. And next to the gate, we have a rock garden where we ask patients, if they want to leave a rock. And we ask them, what does this rock represent for you? And they'll say it may represent the pain and the fear I'm leaving behind. It may represent a past season that they're leaving behind. It may represent their new love for self that they found, their appreciation for life, whatever it may mean to them. And they add it to the rock garden. And then we open the gate for them. And I'll say a simple blessing on them to say that as you go through this gate, you are symbolically stepping into a new life, a new season, and a new chapter of your life. And then they walk through it, and we cheer and we celebrate for them. And we ask them to invite people. It may be everybody at the clinic. It may just be some select friends. But we celebrate and we cheer for them and we champion them as a ritual. Painting a rock and leaving it has no obvious useful purpose. But for that person, it's got a deep, deep meaning. So how do we construct a therapeutic ritual? We have to do 6 main things. First, we ask ourselves, what emotional issue am I confronting? So let's talk about Joni. Joni may feel like the emotional issue that she's confronting is a lack of fulfillment in her life, that she does not have meaning and purpose. She doesn't have community. And so we may choose a location that is meaningful to her. Well, on our campus, we have a chapel, a church building that we have our spiritual programming sessions in. And so to Joni, that church building may reflect the Christian faith that she grew up in, and the times that she sat in a church building where her church community met, and she heard sermon after sermon and teaching after teaching that she believes is not what she wants to agree with and how she treats people. And so she's asked herself what she wants to confront, what location is meaningful, and then we select the item that connects her to the issue. And so she may choose her Bible, and she may take the Bible that she grew up with, and she may say, I want to, instead of reading what I heard, we may during our times have found passages that help her see that God really is loving. That while God does have standards, that God creates every person with unique value, that human beings are made in God's image, and that Christians should seek to see that in other people, and that after she has met with her family, she may find out that she misunderstood that and she missed some of those portions. And so she may choose her Bible, and she may choose a family photo. And what she may do is create a structured process where she takes the photo out and the Bible out, and she talks to it. And the church building, where she says that this is what I learned in the past that was wrong about the Christian faith, and now I'm going to put them all together. And maybe she would open her Bible to a passage that talks about how Jesus loved people that were unlovable. Or maybe where the Bible mentions in Genesis that human beings are created in God's image, and she may put that photo on that page as a bookmarker and close the Bible and say that just as I've closed the Bible, that these things are integrated now in a better picture of what the Christian faith truly teaches. But not only have we created the space and the process, she actually will need to prepare herself for the ritual. You see, the ritual in itself is not where the power is. The power is where we prepare ourselves and give meaning to the ritual. And so if she prepares herself by thinking through in our earlier sessions, in her alone time, maybe she's been praying to God, maybe she's been studying the Bible for herself and listening to other teachers than just the pastor she grew up listening to. And then, before and after the process, Joni will need to reflect on this and what does this mean for her? And finally, as she moves out of that, she's able to move into the last 2 stages, which are renewal and reconnection. Renewal happens when the patient is able to make amends. That through that ritual, Joni can say, you know what, I grew up being taught some things about the faith that don't make sense in my worldview. And now I've reconciled those things. And now she can reconnect her family, friends, and her workplace, maybe even once again with her view of the sacred, of the divine, of even with God. that she's able to reconnect and have a renewal in her life to say, for years I've been running away from my faith, and now my faith is renewed in a way that makes sense of my experiences. And that renewal can be connected to a ritual. It may be something else, but it's when we've processed the spiritual issue to the point that we can say, wow, I can move forward in life again. And the last stage that's connected to that is this idea of reconnection. Reconnection is where the patient goes back home, because the reality is the goal of any patient in a clinic, or whether it's even in a pastoral care setting, whether it's in the mosque or the synagogue or the church, the goal is not to stay stuck. The goal is to move forward and reconcile that pain. In the clinical world, one of the phrases that's often used is this idea of radical acceptance. In the military, we have the phrase where we say it is what it is, where we recognize we cannot change what happened in the past. But what we can do is we can accept it, integrate it, and allow it to transform us into something different. Maybe not the person we thought we would be, maybe not the person we used to be, but into something new. And this is that reconnection part, and it creates support and resources to continue to work on things like our future values, our career plans, and our personal goals. This is where we help the patient to say, wow, how do you reconnect with your community, and how do you develop this long term? Because here's what can happen if we only practice the emotional part. There are many events in our life that may create emotional highs. People can go to retreats, they can go to seminars, they can go to conferences, and they can experience an emotional high. But if they don't learn a practice of life that continues this, it's not going to be sustainable. When we work on reconnection, we have to help the patient or our parishioner or our person we're working with for spiritual care say, how do you make this last? Not saying that there aren't emotional highs and lows, right? There are moments of happiness, there are moments of sadness. But this is not emotions, this is fulfillment. This is living a life that makes sense of their experience. And this is where we help them to basically go back into the world again and live a life of hope and peace. So what does this look like altogether? This is what the pastoral narrative disclosure model looks altogether. It makes a wheel. Because here's the reality. As long as we're alive, we're never done processing spiritual matters. There's always going to be another issue, another problem. And so when we finish the first session, when we start with being committed to saying, I'm committed to fix this problem with rapport and reflection, then we move into the transformation part of review, reconstruct, restore, and the ritual, which leads us back to commitment again of renewal into a new version of ourselves, a newer person, and to reconnection. I like to think about this like software updates. Whenever you have maybe you have a piece of technology or an app on your smart device, and every so often when there's something that's not right with it, it's not working the way it's supposed to, maybe there's a glitch in the program, maybe there's a bug, maybe there's an update that needs to be made to allow it to perform better in its new environment. And so when this happens, there has to be a software update. This is what pastoral narrative disclosure assists with. It assists the person in confronting the issue in a healthy way, processing it, integrating it, and then becoming a newer version of who they are. Not completely changed into something radically and totally different, but an improved and better model of who they were before. And so this is a continual cycle, because once you fix one problem, there's another problem to be fixed. There's another issue. None of us is perfect. None of us attains perfection in this life. And so as a result, there's always another issue to circle back into, to continue moving forward, to continue growing and developing. Now, as we get ready to wrap up this training, there's a few things we need to cover at the tail end. Yes, we've gone through pastoral narrative disclosure, but this is not an isolated thing. Like we talked about, the Spirit is taken care of in conjunction with the mind and the body. So one of the things we have to recognize is that moral injury, right? These times where we injure our spirit and fracture our worldview, they are almost always in connection with the body as well, and the mind. That moral injury and PTSD occur in over 70% of occasions. That a person does not have to be in a physical fear to experience a moral injury, but they almost always go together. Most people are familiar with PTSD. And as a result, for decades, what we've seen is people that have experienced moral injury get diagnosed with PTSD. And it's true, they may have PTSD, but there's often more to it. As we talked about briefly before, PTSD comes from being in mortal danger and fear of your physical life. But moral injury is caused by being in moral danger, dealing with an ethical dilemma or struggle. When we have confusion between the two, it comes from the event that the activating event can be the same. That soldier that ran over that little boy probably experienced both PTSD and moral injury. The problem is moral injury is not diagnosable from a medical perspective. A person can go visit a doctor or go to a clinic and they can get diagnosed formally as having PTSD, but there is no formal diagnosis in the medical books as far as the treatment of diseases and conditions to say that moral injury is here, because it is so personal. And to each person, there's no overall diagnosis. There are similarities, but there's no way to say that there's enough similarities to say, wow, this happens every time, like it happens with other sicknesses and diseases. And so while they're both present, it's important to differentiate. But another important thing that is important to make sure is when we recognize that a person has both PTSD and moral injury, that the risk of suicide and suicidal ideations and self-harm greatly increase. Because not only is the person experiencing physical pain, they're also experiencing emotional pain through the moral injury they experienced. This is a wonderful chart to help us see that there are overlap between moral injury symptoms and PTSD symptoms. Now, like I said, you can have moral injury without PTSD, and you can have PTSD without moral injury, but there are many areas of overlap. And for the sake of time, I'm not going to go through every single one of these things, and so I encourage you to take a screenshot or dig deeper into this as you look at the presentation later. But one of the greatest ideas that we have to sort through is this idea of danger, of the world not lining up with the way it's supposed to. For example, let's say that a young lady volunteers to get community service hours for her high school scholarship by cleaning the church building at night, and that she has been cleaning the church building with the youth pastor. And they've been utilizing that time over the last 6 months to do discipleship training, and the youth pastor's been asking her Bible questions and getting to know her and developing trust. And so the patient, this young lady, who's a patient at the clinic, says that she trusted the youth pastor, that she'd known him for years, but especially during those 6 months of cleaning the church building at night multiple times a week. And the parents had grown to trust him. After all, he was, faithful to be there to keep her safe, to open the building and lock it for her. Sometimes he even took her home and saved them having to come later in the evening to pick her up. They had developed this rapport and this trust. But one night, after months of grooming, he ends up twisting the Bible and explaining that she needs to, in order to make God happy with her, he needs to participate in sexual intimacy with him. And now there is a transgression physically, where she is now having a physical danger, where he's overwhelming her physically and making her in fear of her life, right? Being in physical mortal danger. But now the moral part of how the world is supposed to work emotionally has been fractured. She was supposed to trust this person. He was a spiritual leader. He was somebody she looked up to her. He was a mentor to her, and he betrayed that. You see, these feelings of betrayal, man, are so caught up in moral injury. But it's also tied to the experience that she went through with the physical injury as well. You see how there's this overlap? And how do we reconcile when these things are together? Pastoral Narrative Disclosure is a way that we can help bring that together. And as a closing issue, I want to share one passage from the Bible that I think highlights this. Even if you're not a Bible person, you can still see where the incorporation happens. And this is from the life of a man named Joseph. Joseph experienced a severe trauma when his brothers sold him into slavery. And they hated him so much that he trusted his family, families who you're supposed to be able to grow with, to be safe with. And instead, when he goes to check on them, as his father directed him to, that he ends up being betrayed by them and sold into slavery. And then, To add insult to injury later on, as Joseph grows up during his time in slavery, he's framed for a crime he didn't commit and ends up in a Middle Eastern prison, which is at the time when Joseph's life was incredibly painful in the Egyptian Empire. This was not a comfortable place to be. And eventually Joseph gets out of prison and ends up finding a position of high authority in the Egyptian government. And eventually he gets the chance to be with his family again, specifically the brothers who sold them into slavery. And when they recognize who he is, in the book of Genesis we see this situation happen between Joseph, who's now in a position of extreme power and extreme authority and extreme wealth, and he can get his revenge on his brothers. Look what happens in Genesis chapter 50 verse 18. It says, "Then his brothers came and threw themselves down before Joseph. 'Look, we are your slaves,' they said. But Joseph replied, 'Don't be afraid of me. Am I God that I can punish you?'" What has happened? Joseph has worked through the process of his spiritual perspective to say, wow, I'm not God. Bad things happened to me, but I was not in control. And he says this to them, "You intended harm to me, but God intended it all for good." You see, Joseph was able to go through this process to review, to reconnect, to go through a process of renewing and reconnecting with life, where he could look at the people who betrayed him, who sold him into slavery, that caused him to spend 13 years as a slave and a prisoner, and say, yes, you did intend harm to me. He's not ignoring it. He's not calling it anything other than the truth. He's saying, you did intend harm for me, but God intended it all for good. Through his spiritual perspective, he was able to go through this cycle and renew himself and reconnect with God and ultimately with his family. So as we go through this process and we help our patients and our parishioners go through this process, we can achieve all kinds of incredible growth through it. And they can live a life that through their, especially if they're in a clinical setting where they have a treatment team to address mind, body, and spirit, we can create a model that helps to not only heal them, but also give them a pattern that can be repeated over and over again to continue to address things in their life. And eventually, they may find they're even able to do it on their own without the need of a professional and from the spiritual care area. And so as we wrap up this training, I want you to recognize this is, if you use it, man, this can do so many things in your practice of providing spiritual care. It can not only provide help and hope to people who need it most, but in a clinical setting, it allows you a process that is empirically researched and evidence-based, that gives you a seat at the table if you use it appropriately to earn some connection with a clinical department and a medical department that has all of the research on their side. And as a resource, and I know this is small print, so please go back and look at it in detail, but these are my sources. I want to show you that this presentation, all of the things we talked about today, are grounded in empirical and evidence-based research. This stuff is not just something that's thrown up at the wall and say, see, look how great this sounds. This has been researched. It has been proven. It is a modality that works when it's used appropriately to help people. And you can use these sources to show that, look, what I'm doing is not just, one of the things that happens a lot, and I'll wrap up with this example. Whether the military or the hospital or the parish setting, wherever I've worked, I've often encountered people that say, oh, you're not a real doctor. You're not a medical professional. You're not a real licensed therapist. And they're right, I'm not. But that doesn't mean that what I have to offer them is not something that is valuable. That it's not something that has been, this is something that has been proven over time to work. And when I can bring a model and bring my sources and bring the research to the table, I can say, look, this isn't just, we're not just doing Bible study and sermons in church. We're doing something that shows, and those things matter. Don't get me wrong, from the Christian faith, those things matter. You should be true to your faith and do those things. But this earns us a seat at the table when people look at the actual evidence and how effective and the efficacy of this modality. So I know this was short. This is long time-wise, but as all the things we could have covered, I recognize there's a lot more that could have been said. There's a lot more in this information we could have gone deeper into. So if you have questions, if you want to talk more about this, if you want to dig deeper, please feel free to call me, send me a text message, or shoot me an email. But once again, my name's James Johnson, and I'm so thankful to have spent this time with you. One of the things I hope you will do is apply this and integrate this into your spiritual care and that how you treat and help other people, whether that's in a chaplain setting in the military or the hospital, or in a corporate setting, whether that's in the church as a pastor, an imam, or a rabbi, or a priest, or whether that's in a clinical setting, serving in working in behavioral health care, medical care, whatever your environment, military, foreign, current, stateside, whatever your situation. I pray this helps you and this blesses you and helps you be a better prepared and a more capable spiritual care provider. Thank you so much for your time.